Going. All right, guys, welcome to Dr. Crocker Pet Vet Extra Credit class. So excited you're here. I think that, again, communication is one of the main things that will help you be a successful veterinarian or not. And I think discussing finances is a tricky one. And discussing finances, especially right now, our current climate, is also extremely tricky. So we are going to go over that, and we're going to do a little bit of like case-based scenarios. Also, just give you some ideas of things I've come across and ways I've handled them. But there is no right or wrong answers with these a majority of the time. And again, you have to kind of find your flow and your way of handling these things. My personality is to be very direct with people, try to make a connection, and try to be on the same page with the owner, know what their goal is for the pet, and make sure that we both are in agreement of what that goal is, or bring them around to my goal. So that's always what I'm trying to do in these instances. So let's get into talking about finances. So why are financial talks so tough as a veterinarian? And there's a couple reasons for that. One, it's because clients and you both have intentions, but then there's a reality of the situation. So we go into veterinary medicine because we love animals and we want to help them and we want to help people. People bring their animals to you because they love their animals and they want to help them. However, you have the reality of, one, you can't fix everything. Two, financial constraints are huge sometimes, and they definily take care that people can provide, and that is understandable. And three, you don't know everything without doing tests and without doing things. And so that is a hard concept for owners to grasp sometimes. And so they come in thinking one thing, but the reality of the situation is very different. And that does these talks more difficult. Quality care is not free. So there are some people that provide free care, but a majority of the time, you will be working for somebody or for yourself. It will be a business. You cannot give away your time, your energy, your skill set, your knowledge, all that for free. You have to make a living, and you deserve to make a living as a veterinarian. And so to take care of people's pets, it is not free. It is hard because in our healthcare system, we, for the most part, don't feel that, because you don't go to your doctor and they say, we're going to do all these tests. This is how much it's going to cost. Are you okay with that? My son fell off the back of the couch, hit his head, and he passed out for a while, and we were worried about a concussion. I took him into the ER, and they said, well, we want to do this, we want to do, and we want to do. I said, great. How much is that? How much is the sedation? How much? No clue. The doctor had absolutely no clue how much any of it would cost. No understanding of what it would cost me in the long run. And so they were unable to give me an estimate or an idea of it. And so people don't think about it. And then they come into veterinary medicine where we have to be upfront with them about it so that they're not having sticker shock eventually. And it's a completely different concept than what they're used to for themselves. And so that is something that you have to be aware of. It's honestly, I don't feel like it's people's fault sometimes when they're surprised by how much things cost in veterinary medicine. These are emotional decisions. So again, everyone wants to help their pet, but sometimes they can't always afford to, or how much they can spend is dependent on what they have going on in their lives. And then in turn, we feel like the bad guy, and you have to learn to manage that feeling and that expectation. I am a discounter, okay? I will look at invoices and I'll say, oh, that dog was so sweet. Don't charge to clean those ears. Oh, that nail trim just took you 2 seconds on that puppy. Don't charge for the nail trim. And I will constantly discount stuff, okay? And my husband one time, he's a finance guy, so not surprising, but he said, okay, so how much is the nail trim? And I said, I think it's like $22. He said, okay, let's say twice a week you say, don't charge for the nail trim. That's $44. So let's say you work 5 days a week. How much does that money add up to? And then compound that by all the weeks that you work. That's just one discount you're giving. Think about all that you're giving away that your boss might not love that you're giving away. And I do work off of base production. And he said, you're also not making that money. And when those little things start being looked at and adding up, it can add up really, really quickly. So you've done for what the bill is, but a lot of times you're recommending the right medicine, you're recommending what the pet needs, and you have to let go of that feeling of, ugh, but it costs so much. And it does take some training and some handling the way that you see what they're paying for and the value of it, but you can overcome that. And now I will say much more confidently, well, your pet needs to be hospitalized, it has kidney failure, it'll be 2 to 3 days of hospitalization, and that'll be $1,500. And I can say it because I know it's what the pet needs, and I can say it confidently. And over the years, I've seen that people are willing to pay it, and so it's not as scary for me. And that is something you will develop, but it is something you can start to tell your mind also that you can't feel a bad guy, because all you're doing is charging appropriately for the services that you're delivering. And this is part of that. Veterinarians value their knowledge and time all the time. We don't like the idea of someone having to pay for what we've learned. It is hard for us to come to terms with the idea of we are making money off of people and off their pets, sometimes even sick. And so again, you have to retrain yourself that you have worked really hard. You've worked hard to get into school. You're working hard for 4 years. You're working hard every day in practice, and you really do deserve to be paid well. As a profession and a professional profession, we still are very underpaid compared to our counterparts. And so you can't feel bad for making money off of something that you are really good at, and when you're also actually helping people with it. So the basics of general practice, and remember, I work in general practice and I work in an ER, okay? So the basics of general practice financial discussions are these. It starts with the front desk. It does not even start with you. And that's a really weird concept to think about, but this is where, when you're looking to join a practice, the culture and the way that they set people up, they're going to set you up for success with the way the front desk is, with the way that they handle that first phone call where the client is asking, hey, I have a puppy, it needs to be neutered. And are they saying, well, you need a neuter here is going to cost $120 bucks. And the owner says, great, thanks. And that's it. And that's the last time you hear from them. Or is your staff trained to say, oh my gosh, got a new puppy. That is so exciting. What is his name? Frank. That is a great name for a golden retriever puppy. I am so excited for you. Now, we do neuter here. Our neuters involve pre-anesthetic lab work, an IV catheter, post-op pain meds, and all of that is just $120. Blah, 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 blah. And you are setting them up for, wow, they really care about my pet. They even ask their name. They're excited to meet my pet. And they will do a great job neutering, and it's only going to cost this much. So again, front desk, the way they handle those phone calls, the way they handle checking in, the way your technicians talk to your staff is really important. And it is a team effort. You as a veterinarian are not the only one that are having financial discussions in general practice, or at least you shouldn't be, okay? If you are, I would question that, because I don't think that is a good position for you always to be in as a veterinarian. So just something to think about when you're looking at culture in practice, okay? Now, utilizing your support staff, when I am practicing in my general practice, the majority of the time it's wellnesses, and I know, okay, this puppy needs a fecal, this puppy needs heartworm prevention, they need these vaccines. And so a lot of times new clients, I'm training them, okay, here, we really like to do good preventative medicine. We like to try to stay on top of things with your pet. Here's what to expect when you come in. Let me get you an estimate so you know what it will look like for this visit. And I will let them know what it's going to be. And I will work them into the way we practice and the way we do things. When there's a bigger procedure or something that we're going to do, I will make estimates and my staff will go over it. I do not go in a room and spend 10 minutes trying to convince a client that they need to do a dental. I will explain the value of it before I leave the room. I will come up with the estimate, and my staff will take the estimate back in and answer any questions. And we have trained them to be able to present it in a way that shows the value of what they are paying for. And so I do think the culture and the way your staff is will make a huge difference, especially as a young veterinarian in practice, how easy it is to you to have these conversations. And your recommendations should not be based off of what things cost. They should be based off of what the pet needs, okay? And that's gonna allow you to deliver better quality care. I get asked all the time by clients, okay, so how much does that cost? And my techs will laugh and say, oh, we don't let the doctors give estimates, because we always, always, always say it's less than it actually is. I also, when I'm looking at this pet has a respiratory infection, they need this antibiotic, it's a 80-pound dog, I try not to think about, okay, which antibiotic should I use that's going to be the cheapest and do the best job? I think about what is going to be the best antibiotic to use for the pet. And I try to base my decisions off of the best medicine and not off of cost. Now, some clients are going to say, I don't have the money, and then you do have to go to option B and C, but you always are going to start with best medicine, quality medicine, best recommendations. So my secret is I don't look at invoices. And I know that sounds weird, but again, when I look at the invoice, especially if I know them, or if they're a really cute puppy, or it's an old, like I'm like a sucker for older clients that are super cute and sweet. I will give everything away. And so I don't look at invoices. I see the pet, I diagnose, I make the recommendation, I write up the prescriptions, my technicians fill everything, they do the invoicing, and they discharge people. And I don't look at them. And that has helped me a lot in the long run. One, to say things with a lot of confidence of what people need and what the value is and what they're getting. And two, to not discount when I don't need to be discounting, because what I'm providing is a good service. So this is a quote that I really like. Majority of you will probably know who Warren Buffett is. If you're from another country, maybe you won't, but he's a really famous investor, millionaire, billionaire here. He says, price is what you pay and value is what you get. So again, if you are able to show people what the value is, they don't care as much about the price, or the price seems negligible for what they're getting. It looks like there's some questions about this, Jess?
Yeah, so Rosa just asked a really good question. She said, what if the owner asks you how much it costs in the room? What would be your response?
So they do all the time. And I have great technicians, and I actually, when we are doing rooms, a technician is in the room with us at all times. One, because sometimes owners will not tell the truth about what happens, and it's always nice to have another person in the room. And two, we will often have this silent communication about things where they already know before we've left the room, I'm going to do A, B, and C when we leave to get this person out of there. So again, my techs will jump in a lot of times and joke and say, oh, Dr. Crocker doesn't give estimates because she doesn't know what this stuff costs at the time. Or we'll get you an estimate. We'll make sure to type one up. And so a lot of times they will jump in. I will tell you, I know the standard x-ray fee. I know our standard lab work fee. But if you're asking me about like medications or tests I don't run as frequently, I will often opt out and say, you know what, let me just get you an estimate for that because I want to make sure it's accurate. And I don't guess because I always undershoot it. And people will say, oh yeah, that makes sense. And we'll just make an estimate. Does that answer it?
Yeah, so Sarah Beth gave a good view from being a tech previously. She said, as a tech, I was very comfortable presenting estimates, and I definitely intend to utilize my techs in practice to do it. So that's kind of a perspective from her being a tech previously. And then Shauna asked, what advice would you give your staff if the owner wants to speak to the veterinarian and not them? It's happened to me before when presenting an estimate before.
So a lot of times what I'll say is, again, you're setting a team made up for success. I will say, we're going to make an estimate for you. If you have any questions about it, I'm happy to come back in and talk to you. And so I'll leave it where I will never make my staff have that conversation and not back them up or not be available to them. But I will often let them kind of present it and even let the owner think about it before I go back in the room. And I like to be busy. I like to be really efficient. And so I utilize my support a lot to communicate. They know what I want to say. They know how to communicate for me. And so it really, I would say maybe once every 2 weeks, I'm back in a room and questions. And it's usually more with new clients that just have more questions about the procedure. And I always give low to high estimates because you never want to be right on the money. You always want to leave yourself a little buffer. And so sometimes people have questions about what some of the plus or minuses are. But I will go back in the room if I need to, and I'll tell the owner that. But my staff has been trained, and I feel like we have given them the authority to present estimates with confidence and to know what we would say. And I think that that is part of it. You giving your staff ownership as a young veterinarian in things is going to be huge to be quicker in practice, be more efficient, and also to have more compliance. Hopefully that answers it.
Yeah, that was really good. So Clarice asked how to tackle a situation when the owner comes in and tries to compare the price that maybe they've gotten from other practices. And have you kind of had a situation like that you could share?
I have. So usually it's more phone calls that are comparing, and that's again, front staff is handling that. When I have people come in, usually the comparison is going to be between us and like a low cost place or a low cost spay and neuter place. I will say, listen, I totally get it. You know, that's significantly less than us. Can you just make sure if you're going to go to them that you ask if that price includes post-op pain medication? Because I know I've had some other people go and they have to pay extra for that if they want their pet to have pain control. Or can you make sure that maybe they do a little blood work beforehand? I know they often don't do blood work on pets that are 5. We make sure to do that because even though they're young, there could be pre-anesthetic considerations. So I'm familiar enough with the people in the area that people would be comparing to. I'm not bad mouthing them, but I also know that a lot of people will say, oh, our neuter is $80. And then when you go in, they'll say, oh, do you want your pet to have that pain injection? Do you want your pet to have pain meds to go home? Do you want color? And it'll all of a sudden start like adding up. And I'll tell people, I'm going to tell you what it's going to cost no matter what we do, give you a full picture of it, because I want to make sure you know what to be prepared for. We're hoping it's going to be less than that, but I just want to make sure you know what it could be. And so that's kind of how I handle the comparison game. And I also, this is probably the biggest thing actually about that is you and the way you practice. It's going to work for some people. It's not going to work for everybody. And you do not need to stress out and grieve if someone chooses to go somewhere else, because that just wasn't the right owner for you. You'll be much happier in practice if you have clients that buy into the way you practice and your culture versus trying to mold the way that you practice to everybody. Because if you even think about yourself and people you know, I like to eat at certain restaurants. I have friends that like to eat at other restaurants. I like to shop at certain places. I have friends that like to shop at other places. It is personal preference. And so it's not personal to me as a veterinarian if someone decides to go to the cheap, low cost place. But long term, those might not be my people. And so it's okay if they go. So letting them do that and having that mentality of it's not a personal thing is kind of the bigger picture. Again, you want them to believe in you, trust you, and buy into what you have to offer as a veterinarian. And you don't have to be fighting them constantly about costs if that's not the way your practice is structured. And I don't want to work in a practice like that personally. Does that answer it?
That was good. And there was one more question right now from Christy, who asked about just giving examples of training your staff to help with going over estimates. And would you have them kind of practice with you, maybe some like role playing with you beforehand before you send them off into a room to do it themselves?
So there's 2 things for that. One, if you're joining a practice, I think before I joined a practice, I would always ask them, how do you handle financial discussions? Who goes over estimates? Who makes the estimates? Who invoices? Who checks them out? I think you can kind of see how they structure things when you ask those questions. And hopefully you're joining a practice that already utilizes their support staff and understands how important that is. Now, if you're not, and you go into practice and you say, I want to use my staff more, and I think this would be better for me as a veterinarian to do this, then yes, I think role playing would be huge. I think saying, hey, here's a dental estimate. Now explain to me how you would tell a client what this estimate is, what the difference in the 2 prices are, and what the benefit of doing a dental would be, and kind of walking through each of those things with them. Occasionally, if we have a new technician, I will also, I would say I have my top 2 and 3 techs that are really, really good at communicating these things for me. And I will often have a new technician shadow one of my other technicians and have them give the spiel and go over the information for a client, and train them also that way. But role playing is probably one of the best ones. And just getting your staff in general, especially if they don't already do that, talking about how they would discuss it and how they would present it to a client. Good?
That's good. That's all there is right now, other than Sarah Beth did say you cannot be all the things to all the people, which I thought was a really good thought to keep in mind.
Yes, that is a huge thought. If you ever want to eat lunch, you cannot be all the things to all the people. If you want to leave on time, can't do it. So you want to know that you have a good tech to doctor ratio, and you want your staff to be trained well enough to help you. Okay, so let's go over some scenarios. And this is where I want to hear what you guys would do. That's my daughter at work with me, just so you know, helping out. So scenario number 1 is a 9-year-old Maltese with moderate dental disease that needs extractions. Has never had a dental before. So what would be the thoughts and considerations, and what would be some important things you would mention to the client to show them the value of doing a dental in your practice? And what would be some of the key points that you would want to tell somebody in regards to a dental, especially in a 9-year-old pet? Let's see what you guys have to say. I'll pull up the chat so I can look at it. And this would definitely be one that in the exam, I am going to look at the mouth. I'm going to show the client the mouth, talk about gum recession, talk about tartar buildup, talk about the odor in the mouth, look at the weight of the pet, talk about how dogs will eat even if they're painful. And I know if I've had, an abnormal tooth, it's hurt me. Point out any teeth I think might need to be extracted. So I will give them a visual. I will already talk about the need for the dental, but then doing a dental should involve a couple of very specific things the majority of the time. So can anyone post in the chat what some of those things would be that you want to emphasize and why they're important? So yes, Rosa and Trumpita, yes. So pre-op blood work would be huge. Radiographs, yes. Ooh, I like the telling a story part, the personal story. Sarah Beth, I think that's big. I've actually had people with angry little dogs who have had dentals done on pets, and their pets have become sweet and kind, and they were painful. And I will use that sometimes for owners that are unsure about the dental process. Heart conditions and dentals, yes, that one is big. There's a statistic out there that actually says the dogs that have dental cleanings live longer because there can be so many complications from dentals. And I do like, so Nia talked about how it affects the mouth and the heart, and it's also painful. And that is important too for talking about post-op, that you always do a pain injection and you send home pain medications the majority of the time. I don't know about you guys, but I've done like deep dental cleanings and it's painful. Like I'm taking ibuprofen. So I send a majority of my dentals home on anti-inflammatories, even if I don't do extractions, because I think majority of the time the gingivitis and the irritation is painful. So all those are really, really great and really, really important to say. And so when I do my dental estimates, I'm giving a low to high, and usually the difference is how many extractions I do, and we do it based on time. Dental x-rays are always recommended. We've had a few clients that decline them, a few clients that try to decline extractions, and I personally don't really do dentals on pets when clients decline extractions, because I think you're leaving painful teeth in the mouth and cleaning them up, and that is uncomfortable for the pet. And it makes the owner feel better, but the pet is still painful. Oh, steps, that's good. Okay, yes, I will say that too. That we, and I'll use that for younger dogs more than anything. When there's just tartar, but there's not gingivitis or anything really, really bad, I will say, you know, I really like to do cleanings now when all it is a nice scale and polish. We don't have any extractions. If we wait too long, there might end up being some root involvement, which means we have to extract the teeth. And so that will kind of be the way I'll preface the younger ones. So yes, talking about lab work, you don't even talk about whether or not they can decline lab work. Your pet's getting lab work, and here's why. Your pet's getting an IV catheter, and that way we have vein access to run them fluids, or if anything happens during the procedure, we can provide them with emergency care. Your pet's getting dental x-rays, because we don't want to do this dental and then have an infected tooth in 6 months. We want to make sure that we're thorough. Ooh, Dr. Is the Beatitude here? Oh my gosh, I might be obsessed. Okay, remind clients if you don't take x-rays, you can miss a problem, and they have put, yes. I've had this happen, y'all. I've had people come in for a second opinion and they had a dental done 3 months before somewhere else without x-rays, and their pet has a draining tract of the face where it has an infected molar. So very, very, very important to take x-rays. And monitoring is important. Madison Taylor said this. I will say we do anesthesia monitoring. There's a technician monitoring them during extractions. So they know that it's a multi-personnel and, you know, I used to give a dental estimate and I would say, oh, like $200-300. And then I realized how much we put into it and that I was way underpricing them. And now I will confidently give a dental estimate that is $600 to $800 to $1,000. And people don't balk. They really don't. And I'm always shocked and surprised about that. And so I think on dentals, we've gotten better about educating clients, and we need to say those numbers with confidence. Do any vets on here, can you give me the averages of what you would like charge for your dentals? It's really dependent on your location, I've found, like very dependent on your location. And there's dentals that start at 1,000, there's dentals that start at 200. Andrew says, you tend to charge for nerve blocks. Yes, we have a bupivacaine charge, so it doesn't say nerve block, it says bupivacaine, or we had another one recently, and we would do it. So yes, 800 for cleaning and rads, up to 1,500 for extractions. I would, Christy, I'd agree with you. If it's just a basic like young dog dental and scale and polish 50, is probably not completely out of the realm of possibility, but it definitely, dentals should cost more, and they are a lot of work as a general practitioner. $100 in Puerto Rico. Adriana, you're here, yay.
Hi.
How are you?
Great, and you?
I'm making it. I wish I was in College Station. Well, if I could actually go do anything, so.
Right.
Okay, so the base, so most people are like base of 300, and then the extractions add up. And that's probably how we are, and we also do, so we used to do dental month and do like a discount in February, and we found people were waiting like months to do their dental. And so now what we have done, and this is just something to keep in mind, is we have done if we recommend a dental and you do the cleaning within 30 days, you get a dental discount. And that has actually improved our dental cleaning month. People love to feel like they're getting a discount. And so instead of doing like 1 million dentals in 1 month and the rest of the year being slower, it's kind of moved everything out. And we'll say, okay, this estimate's good for this long. It has a discount on there. And we'll say, if you schedule it within 30 days, you get the discount. And people are like, what? I get money off? And they are all about it. So that's just a little tip trick that you can maybe implement in your practice or think about. Okay, so that is the dental one. Let me do the next one. I want to make sure we have time for everything. 2-year-old lab needs heartworm prevention, owner declines heartworm test, and they haven't had a heartworm test. So let's not pretend like, you know, they just had one and you're doing one just because. We're in Texas, keep that in mind. Heartworm, very prevalent here. So how do you handle this discussion? And oftentimes this is a financial discussion, even though they don't always say that. And so I approach it, I think, from a financial side of things. But what would be some of the points that you would bring up when you're talking about why you need a heartworm test, why it's important? And just so you know, this is really common with preventions, I feel like. Okay. Oh, dang it. Okay. Let's see what you guys got. Importance of testing. Yes. So the cost of treatment versus prevention, that is probably the biggest, easiest one for me. And I will break down like the per month for the heartworm. I mean, it's literally $12 to $15 a month. Dr. Smith's going to be talking about it next week. Yes. Good. I bet she's some good info for us on that. I will cost-wise usually break it down. And I sometimes will joke with people, and maybe this is just me, but I'll say, like, for the cost of 2 Starbucks, you can get your dog heartworm prevention every month. Like I'll kind of make little jokes about things we spend money on that we don't always think about how much we're spending it on, and that it's the same cost as what this would be. And definitely that the cost to treat is significantly higher than the cost to just keep your pet on prevention monthly. That's probably my biggest take-home message I give to people. Ultimately, and this is again a culture thing, if you have an owner who does not want to follow your clinic's protocols, your standards that you have set for care, and you know that what you are recommending is best medicine and what you truly believe in, you will be okay letting those clients go. And I've actually had 3 clients total that I can think of that I said, I totally get it. I know it's a lot. That is our protocol here. I understand if you're not comfortable with it. I'd be happy to send your bird somewhere else if you want to go somewhere else, because a lot of times they have some vet that they used to go to that never did heartworm tests and they don't need to do it. And so why would we be doing it when their vet didn't? And so I'll just say, okay, well, that's not what we believe. And I won't change what my standards are and what I believe, but I will definitely give them the freedom to leave. Every single one of those people have come back, y'all. I'm not kidding you. When you let people know that they can't dictate to you what your medicine is going to be, it's amazing how people will fall into line. And if they don't, and if they leave, again, that is going to be better for you long-term as a veterinarian. Do not mold and shape the way that you are to the owners. Make sure they understand you are doing what is and recommending what is best for your pet. And if they don't buy into that and they don't trust you, then you don't need them as a client. There's plenty of clients out there for you. Dr. Smith said, I would say I have to make sure I'm having a conversation with the client. Yes. Yes. 100%. You need to know why they're declining it. I've had some people worried about it because ivermectin and they have white-footed dogs and, all those other things, trifexis, because they're worried about trifexis causing seizures. So addressing that is really, really important. But the big thing too is not changing your standards for your clients, okay? And I guarantee you most of them, when you really sit and you don't preach to them, but when you explain to them why you think it's important, why you think it's best for their pet, I have found most owners will say, oh yeah, that makes sense. And I also will say, oh, we have a rebate that's this, oh, we have this special running, and that again will get people on board. Let's go to the next one. 13-year-old cat with a history of slow weight loss needs lab work and a urinalysis. Now, I'm saying needs lab work and a urinalysis. This is a owner who is on disability, does not have a lot of money, loves her cat so much. They're worried about their cat. This has been kind of going on for a couple weeks. They finally decided to come in. So they need lab work and a urinalysis. What are some ways that you can handle this conversation, or ways that you can make recommendations that would make the client feel like they're helping their pet still, but also work within their financial constraints? Let's see what you got. I hope that makes sense. If you guys need clarification on like my questions or the things that I'm saying, make sure that you ask me, because it makes sense in my head what I'm saying. And I've been through all these scenarios, so I know what was said and what the reasons were. But if I'm not explaining it well to you guys, I really need you to speak up, because I want to make sure it's clear and that you're thinking and understanding the scenarios. And all these are things that have happened to me. I'm not having to think too hard to pull these pull these up. Does anybody have anything? Nothing's popped up on my screen yet, so that's why I'm not seeing. Okay, a package sent out. That is good. We get great packages through IDEX, and a lot of times if the patient is stable, you can find out a lot. Katrina says, I would explain there's different diseases make an older cat unhealthy. Yes, yes, they will usually save money in the long run if we are more aggressive about diagnostics and testing. The top diseases in a cat with weight loss, for me, are usually going to be cancer, diabetes, kidney disease, hyperthyroid, and all those but cancer you can rule out with blood work and a urinalysis. So let me tell you the way I handle these. Dr. Marshall's here. Yay! Welcome. The way I handle these, and it could be different from everyone else, but I will give the owners time to think about things. And so a lot of times what I will do is I'll say, you know, where are you at financially? I would at least want to do this. And usually what I want to do that I can do right away in-house and is easiest and is the cheapest test is I want to run a urinalysis. I'm running a urinalysis because pretty quickly I can check kidney function, kind of, and I can look for diabetes, okay? I will also usually say, if this test is normal or doesn't give us an answer, we really need to do blood work. But I have found if you have a stable pet, and maybe if you just do one thing that you want to do, and you explain it, and it goes well, and they pay for it, but the pet's not fixed, it still gives a client time to like process what else you've recommended. And sometimes they come back in 2 days because they feel like the cat's still off, and then you get to do all your blood work. Sometimes you present them with the urinalysis and say, okay, it looks like the kidneys are functioning fairly well. It doesn't look like it's diabetes. Really worried about the thyroid. I really think we should send out that full blood work. And a lot of times they've had enough time to think about it, and you've shown them the value already of a diagnostic, and it has gotten them understanding more about diagnostics, and then they'll let you run the blood work. And so I personally, with a stable pet, am comfortable with making a recommendation, having them pay for that one thing. In a vomiting diarrhea dog, you can't afford x-rays or you can't afford blood work, a pancreatitis test. Okay, let's do a fecal. Let's look for something in the stool causing diarrhea. If that's negative, if your pet hasn't vomited for 2 days, it goes home and is doing well, then we'll see. If your pet vomits tonight, we really need to do x-rays tomorrow. We need to do the full workup. Then they take the pet home and vomits overnight, and they come in the next morning doing the full workup. And so I have found, well, I love to get all the information right away. I really do. If you give them time to process it and you have a test that has shown them an answer or given them information, they realize the value of tests. And I don't know if that makes sense to anybody, but what does Sarah say? How do you frame that if you have a complication of angry stressed cat? So angry stressed cat, if I'm already going to be like sedating it or they're angry, I will definitely try to get as much diagnostically done as I can in one sitting. But a majority of cats are not that way, or at least they don't seem like it. Dr. Marshall will tell you he can handle any cat, probably, no matter what. But yes, they could come back with gabapentin. I love gabapentin in cats. But the ability for a client to make a decision, feel heard about their financial circumstances and constraints, and process everything and then come back, I think that has allowed me to have less issues with people with long-term diagnostics and things like that. So just think about that. I know we like to have all the information. I tell clients, I want to do everything because I want to know and I want to get you an answer. And if I can get you an answer and we can treat specifically, in the long run, it's going to help your pet feel better faster, and it's also going to cost you less money in the long run. But that doesn't always work. And so I do think in a stable pet that's something's been going on for a while, slow playing it a little bit can be good. Trompetta wants to know, do you ever write out your top differences for clients and cross them off? No, but that's good. I like that visual. I think that's really visual. That's a good visual to have for what it could be. I will usually just name them, like hold my fingers up like a kid. And then when I go back in the room, I'll say, well, it doesn't look like it's, so I guess I still do kind of give them a visual, but Dr. Smith says, I think having the conversation with the client, helping them talk out the pros and cons, waiting helps them feel heard and appreciated. Yes, yes. And that ultimately, if you can, if the client, and Lauren, maybe you unmute and tell me if you agree with this. Ultimately, if the clients feel like you're not judging them and you're not preaching to them, and instead you're on their team and you're trying to help them and help their pet, I think you get more done in the long run versus this is what we have to do, this is what we need to do. And obviously, we'll talk about ER circumstances, those are different. But in general practice, I think you have more time to breathe and establish that trust in that relationship. Lauren, do you want to unmute and weigh in on that at all?
Okay. I think I messed up here. Can you hear me?
Yes,
No,
I can
my
hear
whole
you.
screen is just a blank screen. Yeah, no, I agree 100%. Clients, they want to feel heard. And a lot of times when they come in with a sick patient, they're feeling very, they're feeling powerless. They're feeling out of control. And they're just, so by giving them choices and helping them talk through those choices, and letting them know that all of those choices have consequences. So yes, maybe you do have a really stressed out cat. And so you have to talk to them about the benefits of, doing everything at once versus the benefits of bringing the cat back and forth, and just hearing them out and letting them and talking through that with them and giving them those options makes them feel heard, lets them know that you're on their team, that you're not judging them, but that their choices do have consequences and you're here to try to help them with, whichever path they choose. I find that people appreciate that because they feel very out of control and powerless. So if you give them a little bit of a power back and really make them feel like they're part of the team and that you're just not dictating what they need to do, they're more likely to trust you.
Yeah, you said it very well. I'm glad you're here. Okay, it's all the time. So I'm gonna move on to the ER. So I would say the ER is a different circumstance in general practice. A lot of times pets are coming in, you don't have as much time depending on the critical nature of the pet. It is harder because you can't make that relationship quickly that you develop in general practice. And so it's a different beast in my opinion. And I have worked both for 6 years. So I feel like I kind of have different modes depending on which one I'm at. But these are some of the basic things I would think about in the ER. So be honest and direct. Y'all, when I walk into a room in the ER, this is when I could walk into rooms, I don't ever say, I'm Dr. Crocker, nice to meet you. I always say like, I'm Dr. Crocker. I would say nice to meet you, but no one wants to be at the ER on a Sunday. Or like, I'll say something to establish quickly, I know you don't want to be here, but we're going to work through this. And I'll try to kind of relax them a little bit about the situation. There is no time to waste though, majority of the time. There is diagnostics need to be run. Sometimes the pet is critical. You really have to establish really quickly, this is an ER, decisions need to be made. We got to make them together as a team and it's going to cost money. And so I have found being as direct and honest as possible is really, really important. And when I will say, and this might be too direct for some people, but it works for me in the ER. I don't get complaints about it. I will say, the hardest thing is we just met and I don't know your financial circumstances and I know you're worried about your pet and this is what I'm thinking. And the more open and honest you can be with me about where you're at financially and what we can do, the quicker we can get your pet care. And I will put it like that bluntly. And I don't need someone to tell me I have $200 or do everything. I don't need them to give me a number, but I need them to know that it's okay to say, hey, especially right now, I just lost a job. Hey, I'm taking care of my aging parent. Hey, this is going on in my life. It opens the door to say, you give me as much info as you can personally, because it's going to affect your decisions. And I know that, and I get that, and I'm not going to judge you for anything you say in this room, but we need to work through this together. And so that is my way in the ER of kind of establishing a relationship of our goal is to help your pet. Now let's do that, go team, and take it from there. And that I have found it to be extremely successful. And I will see people visibly like, okay, like shake their head, like, yes, like we're going to do this, and relax a little bit, because I think they expect us to come in and say like, it's really bad. This is what's going on with your pet. We got, and by me acknowledging being there kind of sucks. And that, they don't want to be there. It just lets them kind of relax for a second. The other thing is, we talked about this before in communication, but explain the why and not the what of diagnostics. I never say, I want to do x-rays, it's going to cost $300. I say, we need to do x-rays because A, B, and C, I'm worried about a foreign body. A foreign body can be a medical issue or a surgical issue, depending on what it is. We really need to know which one, because unfortunately, if we pick the wrong one and it is surgical, they can end up having, you know, a ruptured intestinal tract, and sometimes we can't save them with that. And so I'm explaining to them what the diagnostic does for us as a team and for their pet, and not why, or sorry, why we need to do the diagnostic and not just what it is. Because people don't even always know what an x-ray shows. They don't always know what the blood work shows, what a urinalysis shows. And so you need to explain that, okay? Believe in your recommendations. I think this one's huge. I think that we sometimes will say, oh, we're worried about this. We should probably run this test, but we don't really think that that test has to be run. And so I think you really need to think about what you believe in, what your priorities are, and say it with confidence, because again, that's going to show them the value and they're going to trust you more. Always offer the gold standard. I do not care what somebody looks like. I don't care what car they're driving. I don't care what they're dressed in. Half of them probably are in their pajamas because they're coming in the middle of the night. You always offer the gold standard, and you never, ever, ever assume that someone does not have the financial capability to do what you're offering. I am shocked and surprised all the time, happily so, by what people are willing to do for their pets. And so you should offer best standard of care in the ER, especially because if you don't, you're going to get burned in the long run. And offer options. So yes, offer the standard of care. If they can't do it, you got to have option B and C available. Always make estimates. This is a huge one in the ER, because verbally telling somebody something, they can deny it, but a signed estimate, they cannot. And so if I'm hospitalizing anything, I always have an estimate, and I have a signed estimate before the owner leaves, either the parking lot right now with COVID or before the owner leaves the hospital normally. Estimates are key in the ER. And my staff does not talk to clients about finances in the ER. I'm the point person for that person. I'm the one that they are trusting. I'm the one communicating with them. And so I handle all the financial discussions in the ER. And there's too many staff anyways for me to know who can have those discussions easily, because it's a big facility. And so I do all that myself. And I don't know, Dr. Smith, when you work at veterinary emergency group, do you do your financial discussions, or does the support staff help?
It kind of depends on how crazy it's getting.
Yeah.
I will, yeah.
I'll get like a proof for some things, but yeah.
Whoever has the most time does it. Yeah. It's just in the ER, it's kind of anything goes, and you all just kind of have to pitch together and get it done.
You're like, it's survival sometimes. That's what it is. So. Yeah. But the number one ER complaint is price. And so being upfront about that, working within people's budgets in the long run is going to help you the most, I think, not to kind of get those burning reviews online, and to make sure that people understand what they're paying for. So let's do some ER. Oh, sorry.
In the ER, I'll often tell people when people complain about the price, I'll be really upfront about why the price is different. I tell people, listen, our overhead is just a lot more to keep this place running. And so, you know, if I think it can wait until tomorrow, your regular vet, then you might be, you know, then you can wait till tomorrow. But, you know, and it probably will be cheaper there. And this is why it's going to be cheaper, so that they're not just pissed that you're like upcharging them. Like, I'm very upfront about why things at the ER are more expensive.
Yeah, you know, I always say we have doctors 24/7 here. There's always staff members. Your pet's so critical, they'll probably have their own technician. Like, I do the same thing. I kind of spell out for them how it's going to be different than their general practice. But I
carry drugs that are not necessarily going to be at your regular practice.
Yes. Yep. Yeah. All that's important. And that, again, is showing the value of you as an ER, and things that you don't have to do. Or if there's a dog that vomited once and, you know, is otherwise stable and has eaten like 6 times since then and has been fine, I also am okay telling an owner, you know, I don't find anything on exam. We really should do x-rays. If they decline, say, okay, if it happens again, go to your regular vet. I mean, I think that it's okay to, that's what you're doing, is triaging, in my opinion. And so being upfront and honest about cost and what can wait and what can't is part of your job, or at least it should be. And if you're in an ER that is constantly pressuring you to like upcharge or do stuff, I wouldn't be comfortable in that circumstance, and that's not the type of ER I work in.
I mean, a lot of times I do give people the options of doing the diagnostics or not upfront. Because if it's like you said, a patient that's stable, that's vomited once or twice, where I really don't think you need an x-ray. And if you came into me on GP, I probably wouldn't recommend an x-ray, but you're in an ER and and their clients are clearly nervous if they're bringing their pet to you on ER, I'll say, I don't think we're going to find anything, but if it would give you but I can't 100% rule it out. So if you want, we can do the x-ray for your peace of mind, or we can try to treat. So there are times where I offer both upfront.
Yeah, I think, again, that is just being super open and honest about the situation, and about the cost differences. And I think that just makes you more relatable, honestly. Okay, so the 8-week-old septic Parvo puppy. The current COVID situation has left the client unemployed. This was actually one of mine on Sunday. So the puppy was suspected Parvo. I'll say that first. Number one, for suspected Parvos, my staff always, when they get the puppy from the car, they will say, we're going to run a Parvo test and this is how much it is. They don't even give an option, because I need to know, especially before I bring a Parvo into like my hospital, where it needs to go, if it needs to be quarantined right away. And so Parvo test is the first thing we're going to do. And it costs this much. And I have yet to have an owner say, don't do that, because most of them are there because their puppy's really, really, really sick. This puppy was beyond sick, hypothermic, couldn't even get a blood pressure on her, wouldn't pick her head up off the table. Parvo popped up positive in like 2 seconds. And so this was a tough one, I will tell you that. So what do you call the owner and say, and what is going to be your recommendation? And this is, I think, more common right now with what's going on. And I don't know if other doctors are seeing that, but I'm having more owners, a lot more owners in the ER that financially are concerned because of their current job status. So let's see what you guys are saying. It depends. The pet is collapsed and requiring CPR. Do you talk to him, the estimate? That's a good question. I'll answer that one in a minute. Payment plan. So both Sarah Beth and Jamie hit the nail on the head. There are things, just like Dr. Smith and I just said, there are things that you can do conservative treatment on and they might be okay. There are things that absolutely have to be hospitalized and need aggressive supportive care. There's a couple outpatient Parvo treatments that have been shown to be effective. For a septic, really bad puppy, they are going to die at home if you don't hospitalize them. And I truly believe that. And so my conversation with this owner was, unfortunately, this is a situation where you have to go all out and have to say, I'm in. And I can't even tell you that if you spend this amount of money, your puppy will go home, but it's the only chance it has, or we need to put your puppy to sleep. And it was that frank and that straightforward. I personally think the more you're like, well, I mean, maybe we can, and like, you know, they're really sick, and like the more you slow roll it, play it, I think it's harder on the owners. I think almost sometimes letting them know, this is what we're dealing with, these are the options. And it's the opposite of how I am a GP, but what are your thoughts? What are your questions? What are you thinking? And being honest with them about prognosis is really, 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 really big. Because I have some things that I can tell an owner with confidence, you give me $10,000 and I can fix this. I can fix this pet. I have some things that I can tell an owner, you give me this money and it's 50-50, this pet will make it. And so prognosis is a big part of this. So I think you guys are getting it. Dr. Smith said, in these cases, I make it not about the money. So tell me what that looks like.
So, I will tell them, if we want to try to get your pet through this, this is what it's going to take. And then I kind of like, one, evaluate their face. I'll start by saying, your pet is really, really sick, and we may or may not be able to get him through this. If you want to treat, this is what it's going to take. And I kind of try to read their faces a little bit and see their initial reactions. And if it's clear that they are not up for that, or that they are, start saying things right away about like what the money is, I will say, even if we had all the money in the world, your pet could wind up spending days in the hospital alone without you, and have its last few days just be miserable, and extend the suffering and not get anything out of it. And so even if you had all the money in the world, choosing to put them to sleep right now is a very reasonable option for your pet, because there's just no way that we can, make sure that they get through this. And there's, and that could be just terrible couple of days for your pet.
Yeah, and I think you're softer than me about it, probably. I try to be that way, and I think body language is huge. Now, with what's going on with COVID, the hard thing is a lot of these are phone conversations. I did with this one, I actually have brought my iPad into the ER, and I have FaceTimed with a couple owners, especially when I want to show them an x-ray or it's something more serious. And these owners right away, I could tell that they were already very defeated about the situation. And it was almost, this is weird, y'all, and maybe other people don't experience this, but sometimes it is a relief for an owner to hear you say euthanasia is reasonable, or euthanasia should be considered, or, ending their suffering is like, giving them that out sometimes is a relief to people, because some people know like how sick and how debilitated their pet is, and sometimes releasing them of that, like, you have to do everything you can for them, it actually is a good thing.
Clients should never really have to be the one to bring up euthanasia, I don't think.
Yeah. But body language is a big thing, and the FaceTime has helped me with that with COVID. Usually in the room, I can, like you said, I can read them. But being straightforward about prognosis is huge. If you are not honest about it up front, I think you get in trouble. Okay, so let's move on. 12-year-old lab, sudden collapse, needs stabilization and a workup stat. So I think someone asked about this, about when you have a pet that probably needs like an IV put in, they need fluid boluses, you're worried about them needing CPR soon, like what does that look like? And this is where sometimes support staff has to jump in, because if I'm like standing there and having to say, okay, we got to get 2 catheters and we got to do this, this is what I'm thinking, I'm sticking a probe on because I'm worried about a hemoabdomen. Like when I'm having to do stuff with the pet and I can't talk to the owner, we have lead techs or shift leads, and I will grab one of those techs and say, I need you to go up front right now. I need a quick history, and I need to know if this pet's a CPR or DNR, and they need to know how critical this pet is. And those people are trained very well to communicate in those situations, and they will often get me a very quick, they want you to do everything, or, they said, don't go to extremes, or, they're completely in shock and they could barely function, like this just happened and they had no idea it was coming. And so that gives me a quick gauge of how much to do before I talk to the owner. But I personally am always trying to stabilize a pet, regardless of what the financial situation is or whether someone's improved stuff, until I've had an owner tell me stop or they are a DNR. And until I get that like 100%, I'm going all out for a pet. I'm not like cracking the chest and doing chest compressions, but I'm doing a lot of stuff. And sometimes we eat the cost on that, but I think it's better to do that than to not be aggressive right off the bat and then have an owner saying, why did it take you an hour to do A, B, or C for my pet? And that has just been my experience with it. And again, usually you have a team member in those circumstances that can jump in and can have that discussion very quickly. There's no signed estimates. That is truly off of trust with the owner. and a communication and discussion. And then as soon as I can step away, or if I've drawn off some blood off the belly and I can have a discussion with them about what it is and what it's going to take to get them through this, then I'm the one that's going to the owner and having that talk. But I always start stabilization right away, and I don't worry about the money. Now, these discussions with these super critical patients is kind of similar to the Parvo puppy. Prognosis is huge, reading the owner is huge. Sometimes buying time is big if this is something that just happened and they had no clue their pet had a splenic tumor and it just ruptured. But I think that these discussions are similar to the puppy discussion. So I'm gonna move on to the next one because we're gonna run out of time, guys. 4-year-old cat, blocked, very lethargic and depressed. So quickly, what are your recommendations? What are you focusing on? Is this a true emergency? What are you worried about? And we'll kind of talk through this one really quick and the next one. And then I just have, I think, one more slide and then we'll be done. Thank y'all for hanging in there. I know we're a little past 9 o'clock, so hopefully y'all are doing okay and still learning something. Blocked cats are tough sometimes. True emergency, need to unblock and deal with electrolyte balances. Yes, true emergency, yes. So personally, block cats are true emergencies, but not like crashing pet CPR emergencies. So I do feel like you have a little bit of leeway time in there to have a discussion with an owner about your cat is blocked, likely it's hyperkalemic, what that means. The kidneys are probably compromised. This is not just about unblocking your cat. We probably have to address A, B, and C. And what I will often say is, let me get baseline lab work and let's go over how compromised they are. And that will determine financially what you might be looking at and what to expect. But it's focusing on the big picture with these cats and not just the blocking. I haven't had any that couldn't get some pain meds and wait just a couple minutes for me to talk to an owner and go over specifics and even present them with an estimate. But that's just me. Lauren, do you have any thoughts on that one?
Yeah, I agree. Generally, these guys come in and like you said, you at least have time to talk to them. Worst case scenario, assuming, I mean, I guess the one exception to that might be if the bladder is, well, I mean, I guess if the bladder is ruptured, you still have a few minutes to talk because you're not getting that cat into surgery that quick. If the bladder is really that big, you could always, and you're really that concerned, you could always do a decompressive cystocentesis first to buy yourself a little bit of time.
Yes, and I think it's important to know when you need to give the owner FaceTime and when you don't, and also things that are very quick emergencies and things that are going to be drawn out. And blocked cats are 100% drawn out, and I think it's also a lifetime issue sometimes, and so it's a lot, and it's a lot for owners to take in, especially with the first time they've been blocked. If it's not the first time, it's even a longer conversation because sometimes you may be talking about doing a PU versus unblocking and hospitalizing and all those things. Sarah Beth asked about giving calcium gluconate to protect the heart while you have the conversation. So I honestly haven't had any that are so bad that they're severely bradycardic. Most of mine, even though they're really painful and they've been blocked even for a while, they are not significantly hyperkalemic and bradycardic. I don't know, Lauren, have you had a lot that are bradycardic? I haven't ever had to consider that personally.
Yeah, I mean, I've had them where you would expect them to be bradycardic, but they're really not that bradycardic. Also, calcium gluconate needs to be given over about 15 to 20 minutes. It's not something that's going to have an instantaneous protective effect anyhow. I mean, I guess if you were really that worried, the quickest thing to give would probably be dextrose.
Okay.
Yeah,
so
but
15, 20 minutes is still a long time in the ER. I mean, it's crazy the things that will come in that literally it's insane, and it feels like it maybe is a long period of time because the dog is crashing, and then when you look back, it actually was a really short period of time, but so much happened so quickly. But a majority of the time, you will have time to take a breath, come up with a plan, and talk to an owner, and even talk about finances before you get into a lot of treatment. There's not, I mean, there are true emergencies, but that's not what's just rolling in the door, or at least hopefully that's not what's rolling in the door on some nights. So, okay, we see exotics at our ER, a ton of exotics, and you have them come in, and they're usually very compromised. So you have a 5-year-old bearded dragon with a prolapse, underweight, hasn't been eating for 1 week. What are your considerations with exotics in the ER? I definitely approach these way differently than I approach my dogs and cats. And I don't know if anyone on here ever works with exotics and would have any input, but there's some pretty significant differences, I think, with exotics than there are with dogs and cats. So what do you think some of those main differences would be when you're having these discussions, or your thought processes? Anybody? I have somebody. Management's the biggest issue. Yes. Management history is huge. Usually they're so compromised because it's been going on for a long time. The owners haven't really noticed that they haven't been eating, or they haven't been doing what they need to do. So for me, the biggest and hardest thing with exotics is diagnostics are really difficult to get. Like a ferret, you can get a blood glucose because you're worried about insulinoma and you need to know that. But getting blood on a bearded dragon, even getting x-rays sometimes is tricky unless you have a horizontal beam x-ray. We work next to a specialist, and so we will a lot of times stabilize these guys and keep them, and then we will send them over there for diagnostics. And so really with the exotics, the conversation is usually they're really sick. They require pretty extensive workup to figure out what's going on. And usually we are doing supportive care, and we're sending them to the specialist because, again, getting blood, putting in catheters, all those things are tricky. Christy, you're welcome. Okay, one more slide. I'm sorry, y'all. I know it's running long. So important to remember, never assume anything at all about someone's capability. Always just be upfront and honest about what you think their pet needs. Always offer the gold standard. Don't undercut anything. Don't second guess what you're offering. Offer it, put it out there, say it with confidence, show them the value, and see what they say. Know your value. You've worked hard, you have knowledge, you deserve to make money as a vet, and it's okay to charge appropriately for what you're doing. Utilize your support staff. I think it's huge. I think in general practice, when you're having financial discussions, it is one of the things that honestly can make or break your day, whether you're having to have all these conversations or your staff is trained in it. And do not let an owner's financial constraints make you feel like less. Just don't. Putting down that 8-week-old Parvo puppy, y'all, I'm telling you, it was heartbreaking. Like, we were all crying. It was really sad. But it was the right call. That puppy was trying to die on its own. But it's tough. But I can't let the fact that they can't pay for care make me feel bad about what I'm doing as a veterinarian. I can be sad, but I don't want you to ever feel bad because someone else's financial constraints. So real quick, remember, follow me on Instagram and my website. And I had said, if you shared my post on Instagram, you could win a sticker. These are the sticker winners. So if you're on here, congratulations. I know Dr. Shauna and Double of Vet Students was. Message me and I will get you a sticker, a Black Cats Rule sticker. And I will take questions. If you guys have any questions that are specific, you can DM me. I really appreciate Dr. Marshall and Dr. Smith being on here. I know it's late. Hopefully this was helpful. I kind of just pulled stuff that I have dealt with. And you guys were great at answering questions and interacting, so I really appreciate it. So thank y'all, and have a good night. Bye.